Back now with Dr. Darien here answering one of your medical questions. And I'm actually really curious about this too. Can mouthwash raise your blood pressure? That is from Pina H.
You know, when I first saw this question this morning, my first response was no. But then I did some data. Our med unit went into the research, and the answer is there is some findings that show that mouthwash can increase one's blood pressure.
How and why?
The reasons why are really interesting. So we have bacteria in our mouth that produce something called nitrates, and that naturally lowers our blood pressure. So when you use mouthwash, the theory behind this is you get rid of those bacteria, you don't have those nitrates, and then we're finding in certain studies where people repetitively or use mouthwash 2 to 3 times a day, they have elevated blood pressure by 2 to 5 points. It's not significant, but if you're really trying to closely monitor your blood pressure, it might be something to think about.
Keep using it.
I think in this case, the benefits outweigh the risks.
I mean, nobody wants to have stinky breath.
Absolutely not.
What's your prescription for wellness?
It's about finding information online. The more and more we use the internet, obviously, the more information we get from it. As a physician, I am used to patients coming in saying, I figured this out online. Please tell me if it's true or not. And so I thought it would be helpful if we just talk about some basic things you should do when you're finding information. First and foremost, check the original source, making sure you understand where the information comes from, who's financing it, who's publishing it. Secondly, you can also reference government or medical school sites. So you check the web address. If you see .gov or .edu, that's usually more of a formative form of information that you can probably trust at a better level than something shared on a random social media site. And then lastly, look for recent articles. Check the date. Aside from wondering if you're going to be involved in this study, make sure that it was published recently so that you can use the most up-to-date information.
And follow up with your doctor, because I've diagnosed myself so much with something that I didn't have.
We all know. But
Right.
I enjoy it. Bring that information to the doctor and ask them about it. Everyone should be able to understand what's going on.
All right, thank you, Dr.
Don't you love it
Darien.
when you have a patient who's like, hey, I know what I have. Can you give me this prescription?
You're like,
listen.
I'm the one that went to school. All right, doctor. Folks, we would love to hear from you. So hit us up on Instagram with all of your medical questions for our medical team at ABC GMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.